Okay, great. Welcome everybody to our June webinar, our pillar webinar. Everybody is joining. This is great. Okay, so we are privileged today to have presentations from three C4K communities who are going to be discussing partnerships that were built between medical facilities and childcare programs. So a warm welcome to those visiting from Columbus, Holdridge, and York. We'll get started with that in just a moment. I just had a quick couple of reminders for everyone. First is the C4K end of year survey, if you haven't already completed it. Those are due June 27th. They should only take about 15 to 20 minutes to fill out. And then only one report is needed from each community. So make sure to touch base with your core team and figure out who makes the most sense to fill out. Also, we're coming toward the end of the C4K fiscal year, which means if you currently have a Communities for Kids contract with Nebraska Children, it's time to finish up your spending. Billing packets on web grants will be due no later than July 15th for expenses that are in June. So make sure you have a plan to get those done or reach out to your technical assistant if you need any help. Our next C4K pillar webinar will be Wednesday, August 6th at 12 p.m. Central, 11 o'clock Mountain. We're working on confirmation of the topic, but we'll get that out really soon. So I'll drop that link a few times in the chat throughout the meeting just to give all participants a chance to see it. So that's it from me. Just so you kind of know the schedule, the organization of today, we'll first hear from the Columbus team, followed by the Holdridge team and the York team. And then at the end of the three presentations, we will have questions. So I will turn it over to the Columbus team. Go ahead and take it away.
Good afternoon. My name is Scott Messersmith. I'm Vice President of Operations here at Columbus Community Hospital. Joining me is Melinda Long. She's our Child Care Director, and I guess we were tasked with just telling a little bit about our story and how we came up with the center and the idea. So, in a quick nutshell, for many years, probably up until about I don't know, 4 or 5 years ago, Columbus Community Hospital, we had a very large need for childcare. Our employees had wanted us to get involved, whether it be via stipends, whether it be a building, whether it be a joint operation, uh, probably from about 2007 until about 2015 in our town of Columbus, about 24,000 people. There was a lot of discussion. We were part of an employer consortium who actually looked at combining funds and building kind of a community center between us and maybe 4 or 5 other very large employers. We had a study done, a consultant was brought in, said, this is what it would cost to build. This is what your operations will look like, and this is the amount of funding that each of the employers would need to contribute. Uh, Maybe 6 months to a year went by, and no one employer really stepped forward and said, "Yes, we're ready to move forward with this." And then it just kind of died. Without all of those employers contributing, it was everybody else had to contribute more. And again, all the employers just kind of let it die down. So in about 2009, we did a real informal analysis of our staff and we heard there was a need. We kind of estimated at the time, hey, if we could build a center for 70 kids, seems to fill the needs of our staff. At the time, we were about 500, maybe 600 employees. So that was 2009. Another 6 years went by, and then we got really serious. We formed an internal committee. We actually did a full hospital-wide survey of all our staff, asking, okay, truly, what are the needs? Because we can set aside some money and build something that would satisfy our employee staff. And we did the survey. We received strong interest from about 10% of our staff at the time. So about 50 to 70 employees said, yes, we would take our children there if you built something. So We set out in 2016 with plans to build something. And in 2016, we took something to our board, which formally approved it. They said, yes, move forward with it. Here's some money. Make sure you build it, for some growth in the future, because we knew once we build it, it becomes a recruiting tool and a retention tool. So again, we brought an architect on at that time. We got a contractor on board and analyzed the building setup. And because of the rooms, the number of rooms that you could need, and because of staffing ratios, it was best to build in kind of quantities of three infant, three toddler, three uh, preschool, school age. Um, and so in that regard, we were able to build the center for about 105. We're licensed for 105 kids. So the other thought there is, again, we said roughly 70 people expressed interest, and we built for 105, allowing for some growth. The additional 35 spots or 35 spots that we had in there, we talked to city and we could be tax exempt if 80 to 90% of the center spots were designated for employees of our hospital. And therefore, we built it knowing we could take on some public. Well, within I don't know, 2 years, or excuse me, within the first day we opened the building, we were sitting at roughly 100 kids. We were at capacity with some public. Um, uh, well within the 20%, 10 to 20% that the city said you could have to remain tax exempt. So fast forward today, and we are completely full. There are very few of our positions, or excuse me, our openings that are actually available to the public. The vast majority are going to our staff. So almost instantly, we have grown to the point where it is full. We don't need public support. And we offer an amazing program that Melinda will talk a little bit about. So I'll just share with you real quickly. Let's see, PowerPoint, maybe. Okay, a little bit about our history, our business plan. Um, this is what our center looks like today. We're at 13,000 square feet. The project cost was about $3.5 million. It's licensed. Melinda will talk about the hours of operation. Again, we are completely full, 105 spots, but I think it entails 130-ish kids with various part-time and drop-in care factored in there. It's fully staffed by hospital employees, and I think one of the cool things is this partnership, given that it's hospital run, owned, operated, they are hospital employees, so our childcare staff receive full benefits that the rest of our hospital does. So it made it extremely attractive for us to find good qualified employees where others have struggled. So I'll turn it over to Melinda again. I remember discussions with Melinda as an applicant for our center back in the day, and she has been a superstar, has been involved not only in the last parts of the design and the build itself, but the establishment of all of our programming, all of our policies, all of our forms, et cetera, the regulations and everything, that she has just been a huge asset. So I had the easy job of building the center, whereas Melinda had and now has the huge responsibility of dealing with kids, staff, and parents. So with that, I'll turn it over to our wonderful Director of Operations of the Child Care Center, Melinda. Yes. Yep.
All right, I put this slide in here just because it shows like the outlook of the center, but there is some differences. Like there's a school age room. We started with a school age room, but then we needed to grow. So we actually, where our school age room is, we added a pre-K room. And then our activity room turned into like a toddler prep room. So it's like your toddler and infant age. So we kind of added some rooms in there as we went and increased. So this is just a glimpse of like our infant rooms. So the left top is like our toddler prep room. So they're anywhere from 15 months to 24 months, depending on what we need. That top right is like infant A. So everything I wanted to look homey. I didn't want anybody to come in thinking it was a center. For myself, I wanted it to be a home for all my parents. So everything we got was more homey versus commercial. And then the bottom left is like your 12 to 18-month-old room. So they're sitting more in, little box chairs and kind of getting into that transition. And the bottom right is just another infant room. Then the toddler rooms, they do a curriculum every day. It's called Frog Street. They have circle time every day, art, math, everything. Even when they're young at 18 months, they're doing things with them. So it's the toddler rooms. And then there's preschool rooms. So these girls, I got a grant and got everybody a smart board. So they do a lot with their smart boards. In their curriculum. In the summer, I let them kind of do what they want with their curriculum, but during the school year, they have a set curriculum. This is just special visitors we have, the firefighters. We always have a career week. We have our service dog Eden comes in to visit. Santa comes, the Easter Bunny comes. We have the zoo come, just all kinds of just different visitors. Preschool playground. I just got a grant recently that added some things to our playground and the surfacing, and we added, you can see that we added the turf so that kids can kick balls and nobody's getting hurt. This is our toddler playground. And then this is an infant playground. So this is a different grant I got that we were able to put in a toddler playground, or sorry, infant playground, sorry. Then I was just going to talk about resources that we have with the hospital. So it's awesome having the hospital behind us because we have all these things that back us up versus a different daycare. So like your plant operations department is like maintenance. So they do all of our lawn care, work orders, plumbing, painting, flooring, air handling, fire alarms. Your marketing department who captures all the events that we do, and they help us make programs and awards and just anything we need. Housekeeping, that's where we get our linens. They do our laundry, anything chemicals we need. They come clean our center every night. Human resources helps us with monitoring job openings, applications, employment, providing us with benefits and wages. Accounting does all of our, deposits and helps us with our budgeting. IT or IS, your information systems, helps us with all our computers, keeping us up to date on all our software. Switching things out if we have issues. I have cameras at the center, so they help with those. We call it SPD, our supplies purchasing and distribution is just that. They get us our supplies, they help us purchase things, they bring us our supplies at times. Quality improvement helps us with like our surveying. So when like DHHS comes or we need help with knowing if somebody's sick, like sicknesses and what's okay to have in the center or not if we have a question about something. Nutrition services is like your kitchen area. They come and bring us our food every day. And we do get some supplies from them too. Volunteer services. We actually have volunteers that can come in and they help with the babies, or we have volunteers that help with preschool age that just come in and take that time just as an extra hand. And then the professional practice, like the education department helps us from time to time. We had somebody with an EpiPen allergy and they came in and actually taught our staff about EpiPens and what to look for in food allergies. Future, we're always surveying the needs of, our staff and the child care. We're surveying wages constantly to make sure that we are where we need to be with that. Grants, I'm always looking for more grants and things we can do with the child care center, and then always looking for more training opportunities that are out there. And then you said we'll do questions at the end, but that's all I have for the center.
Okay, great. Awesome. That was wonderful. Thank you both. Okay, next we will hear from Team Holdridge. So take it away, Team Holdridge.
All right, so I am Lindsay Sullivan, the Director of Fiscal Services and the Controller here at Phelps. I've been here 11 years and have been part of our daycare task force for about the last 3 years. I have a personal interest in the child care. I have 4 kids, so all 4 kids have gone through full-time child care at some point in their lives, and it's just been a huge benefit for both my husband and I, helping us grow our careers and provide for our family. So that's kind of the backstory of how I got involved with it as with our hospital, but we're excited to share a couple things of how we're partnering with the community and then also steps we're doing to expand access for families.
And I'm McKenna Fahrenbrook. I'm the program director and then the director of the Holdridge Area Early Childhood Partnership. And I've been with the organization for almost a year now, and we fully formed our nonprofit 501c3 in September.
So just a little background about Phelps. We are a 25-bed critical access hospital. We are a nonprofit governed by a 13-board member. We do have a little bit of a different structure than maybe most critical access hospitals have in that we fly in a lot of specialists. So we're able to add a lot of different services that's allowed us to be in a good financial situation. So we have like ortho, oncology, spine. We've recently added cardiology and the cath lab. So this has just allowed us to look for different opportunities in the community to help support Phelps County. We employ about 345 employees and contract with an additional 150.
So with the Holdridge Area Early Childhood Partnership, we were initially our Communities for Kids group, and we decided with long-term sustainability that we needed to form that nonprofit and kind of come up with the partnership. So that's where we started that, and we were officially formed in late 2024. So in September, people also refer to us as HACCP, so you might hear that as well. And basically just the forming of this was just that we wanted to make sure when we stopped receiving our initial grants that we had applied for through the chamber and through Communities for Kids, that we would still have that long-term sustainability to help our local childcare community.
So on the hospital side, how we initially started getting involved in daycare, I think it was at the end of 2022, the biggest center, or one of the biggest centers in Holdridge, was a church, and they operated that center. And they gave notice to the families and their staff that they were no longer going to operate that. But they did have a plan to bring in another provider center she was going to operate a second location, and they were going to lease that to her. So through that transition, not all the staff was retained. So therefore, some families were out of spots. So it did cause a little bit of panic. My family was involved in that as well. So that was brought back to our senior director team. So that's when we started kind of researching how we can help the community. So we first created an internal group and surveyed our staff. We asked questions like what their daycare needs were, how many kids they would be looking for, the age ranges, hours of operations. We had heard we possibly needed to look for extended hours, and then just what's the most important thing when they're selecting a provider. So we had, I think, about 110 employees give feedback on that. One of the main things we found out was quality and environment, and then cost and location were really important to our employees. And then hours of operations. I think originally we thought they would be looking for more like 24/7 care, but it came that the earliest our employees were looking for was 5 a.m. and the latest 8 p.m. And that kind of falls in line with the nursing shifts. And then also our surgery department, with those surgeons flying in, they can have certain days that they have longer hours. So we've worked with McKenna's community group to really look on how we can piggyback off of them to try to find extended hours. So after that, we did initially start researching whether we should build a daycare, but at the same time, the C4K group was also forming in the community. So we did kind of put a hold on that and kind of let that group get established. We were actually finding there was maybe enough licensed spots in Holdridge, but the perception was that there was a lack of space. So we did little things like we provided a list of every single daycare with all the contact information to our employees and put that in the internet. And then through that C4K group, the chamber was able to add it to their app that they have. So just an easy way for our employee to even know what's available. And then we've had 3 members serve on that group with McKenna. So our CEO and then myself and one other director.
So then with that, when our C4K community formed, we did a study and kind of came with the same information the hospital came out with. And that was that we needed infant spots as well as extended hours. Other than the hospital in our community, we have Embecta and Almond Brothers, and then a couple nursing homes that also have 24-hour shifts. And so that was kind of the biggest need. So from there, we kind of decided that we needed to incentivize our providers to open more infant spots or offer those extended hours. So we came up with our programs. And so we have the infant incentive program, and then we have the extended hours program. And basically we have 4 centers in this. And so we have 2 centers and then 2 in-home. And so they just have to be and step up to quality and be a licensed child care center to be in our programs. They fill out a roster each month, and based on the amount of infants that they have and the amount of extended hours that they provide, we give them an incentive check on that. And we've started those in October, and we officially launched them in January. So we've seen some really good growth with those. And our centers have really said it helps pay for food, it helps pay for items they need for their centers, or things such as staffing as well.
All right, so now kind of full circle where we are at. We have come back around. There has been some changes in the daycare availability, with some centers not super confident on their leases, if they're going to be able to stay there long term. So we have taken that to our board of directors, and so far they have approved to begin pursuing a building project. It is pending our final board or the final budget approval with that, but we are hoping this will be a 6,500 square foot building and provide space for 100 children. We're looking to get final approval in Q3 and have the construction completed sometime in 26. One thing that is different about this, the hospital it's actually our subsidiary company is going to own the building and then lease it out. So we've opened applications out to any daycare provider or childcare provider that would like an opportunity to lease that building. We do have hopes to negotiate some preferred priority into that, but it will be a community center, not just for Phelps employees.
Great. Awesome. Thank you. Okay, one last presentation. York team, take it away.
Let's see if I can share my screen. Right. Can everyone see that okay?
Yes.
All right. So, welcome all of you. I am Tamara Weens. I've worked here at York General for 22 years now, in my current position as the Director of Compliance, Quality, and the Westview departments. Westview encompasses our child care center, so I think that's why I got the honor of presenting to you guys today. And I just want to state before I start, Melinda from Columbus, she has been a great resource in our project for our new childcare. So if anyone ever has any questions, call her because she is an expert on childcare. Maybe she didn't want me to say to call her, but she has answered so many questions for me and I really appreciate it. See if I can get my next slide to come. All right, so who we are. So York General has around 500 employees. We have a 25-bed critical access hospital, a long-term care facility, assisted living, a dialysis unit, home health agency, outpatient oncology and infusion, an outpatient specialty clinic that sees around 200 patients a week minimum, and then we also have a child care center. So like I said, we do have 500 employees. Our current center is very old. It's actually located in the basement of the old nursing home here in York. So it's not ideal, but it has kind of been built to work for what we need. We really use our childcare here at York General as a recruitment and retention tool because, as you know, staff need childcare, and York doesn't always have a lot of options for childcare or even openings. So we've really always used it as a recruitment and retention tool. We have the pending addition of an additional 66 employees. We are working on purchasing the York Medical Clinic, which is a physician-owned clinic here that is attached to our hospital. Now, obviously, not all 66 employees will need childcare. We do expect some additional need. Right now, we are currently licensed for 70 kiddos. With our new build, we will be licensed for 100 with hours from 6 a.m. to 6 p.m. We currently have a waiting list for our own staff. So we're curious to see what that will look like once we open our new center. And then we also have quite a bit of community interest. Even though the community knows that we only serve employees, they still call and ask to be put on a waiting list. And so because of this, when we were looking at building our new center and planning for it, we knew we had to increase the size because we want to somehow be part of the solution, not only to provide childcare to our 500 employees, but possibly have room to offer some spots to the community. So our new building that broke ground last month, it will be a single floor building with a second floor mechanical space, which will go in the corner of 25th Street and Lincoln Avenue, which is really close to all of our York Journal campuses. The main entrance will face the east. It'll be stick frame building and have space for up to 100 kids. Like Melinda said, they don't really use their school age room anymore. We do have one of those planned, but we expect that will probably be used for more preschool age as time goes on. Of course, we'll be licensed by DHHS Monday through Friday, 6 a.m. to 6 p.m. Something we don't have right now is the video monitoring in all our classrooms. And we just have it in the hallways and entrances in the playground. So that's something we're excited for. We also don't currently have a kitchen that we prepare our own food in. Our long-term care facility prepares that and brings it over every day. So they're super excited not to have to make food for childcare anymore. And we're excited to have our own kitchen and lunchroom. And then we'll also have a nice multi-purpose room in the center of the building, which will be built as a certified safe room. So in case of inclement weather, we have that for the kiddos and staff. We also have parking. Right now, our parking lot is a gravel lot that is many times just a mud pit. So we are excited to have a concrete parking lot for parents and staff. We will have 3 playgrounds with direct access from the different rooms. So they'll be all separated by age. Right now our playground is mulch. It's kind of a mulch pit. So every time it rains, it's kind of just a compost and we just keep putting new mulch over the old mulch every year. So we're excited to have rubber and concrete and turf on the playgrounds. And then we'll have a nice 5-foot fence around. These are just some pictures of what our playgrounds are going to look like. If you ever are interested in different playground companies, I think I've worked with pretty much everyone in the state over the past year, but we did end up going with Burke, and my rep is out of Omaha. Some other features, we're going to have the smart TVs and preschool and school age rooms like Columbus has, which that idea also came from when we toured Columbus. Curriculum for all age groups. Right now we do have curriculum for all age groups, but we're looking to kind of expand that. STEM science stations. Everybody wants a programmable robot. So our current staff did a great job of coming up with ideas to budget for the new center. So we're super excited for some of the things we're budgeted for. Math centers, sensory tables, column corners. This is a photo of kind of what the front of the building is going to look like. Obviously, there'll be playgrounds on each side, so it will look a little different from the road. These are our interior finishes and kind of the color palette that we're using, incorporating the 3 York General colors and then other colors that match or go with it. We're using solid surfaces on all the countertops and then the laminate flooring. This is an example of what our entrance is going to look like with our logo on it. So when you walk in those front doors, you're going to see that bright, colorful wall and the York General Children's Academy logo. These are the designs of our corridors. So each room is going to be identified by a shape and a number and a color. This is an example of what one of our infant rooms will look like. So the cribs are separated into the back of the room with that nice mural painted on the wall and some storage. And then this is another example of what a toddler or preschool room might look like. As you can see in the one wall, there's the windows that lead into the restroom. So if there's a teacher changing a diaper maybe on this counter, she can also be looking into that room if someone, an older toddler might be needed to use the restroom. And then this is an example of a mural that's going to go on the wall in our safe room / lunchroom or rec area indoors. So some financial considerations. Like I said, we wanted to build to 100 and we hope to have it occupied with 100 kiddos within 6 months. To get to 100, we do believe we'll need to expand to community children. And then our rates will be increased to market competitive in the York community. So right now, our staff pays what we consider a little bit of a lower rate than the community, but with the new build, we plan to have the rate be very similar to what you would pay in other centers here in York. Why is this new childcare facility important to the community? Like I said, we are really focused on retention, recruitment of quality staff, and we really think that having this available to our staff is a huge benefit. And we also are trying to be part of the solution for the childcare shortage in the community of York. Does anyone have any questions?
Before we start with questions, hang on just a second. I just want to say these were all excellent presentations. There is so much symbiotic work going on with these partnerships in these 3 communities. So I will open up for questions, but I just also want to say for anyone who's watching the recording, it's still okay to ask questions. Get those questions to me or to your C4K technical assistant, and we'll get those where they need to go. It sounds like all 3 groups are more than willing to keep the discussion going and be a resource for you if you're considering something like this in your community. So that said, I'll be quiet and open it up for questions for all 3 programs. We're informal. Go ahead and come off of mute and shout it out.
I have a question, and this might be for all 3 of you. So this is Shauna, a technical assistant for Communities for Kids Communities. Oftentimes when communities are looking at something similar to this, whether it's partnering with the hospital to do its own specific project or like Holdridge bringing multiple businesses together with the hospital kind of being an integral part of that process. When some communities have started this and they're talking with those businesses or those organizations like hospitals, and oftentimes they hear no, it's not possible, we can't do it, it's not something that we're considering. I'd like to hear from you guys as your perspective of those of you who've had those facilities already going and operating, and you're looking at like York looking at expansion, but Holdridge just looking at this opportunity for parents to have more access with their infants and after hours care. What, from an HR perspective or from a hospital perspective, do you see employees more invested in your businesses because you've done this? Because I think that could be a true telling point when people are starting to engage in these conversations and hearing to say, our employers are happier, our employees are dedicated to us, our employers have better production, and we all feel like this is associated to what we are doing to support early childhood.
I think I can start by answering that. I think our employees are extremely invested in our childcare because they know that if they leave the organization, they have 1 month to find new childcare. So I think it's kind of that fear, like, I have this amazing childcare that I love that my kiddos go to, but if I leave York General, that goes away. And then what options do I have? So it almost feels like we're holding them hostage, but we're really not because we have an amazing childcare, I believe. But I know as far as when approaching hospitals, as far as those collaborations, a lot of it does boil down to our nonprofit status. So I know someone earlier mentioned only 10% community to stay that nonprofit status. And I think that's kind of always been our mindset because our childcare here at York General obviously is not set up to be profitable or even break even. We don't even come close because we offer all the benefits to our employees in childcare that everyone else at York General gets. So it's the paid time off, the 401k, all those things. So that does make it difficult when you're considering that tax exempt status to maybe completely open it up 100% to community. Does that make sense?
So I'll piggyback off that. So we have always said by retaining or recruiting one nurse, so by just attracting one nurse and preventing one nurse from leaving, it right there pays for our losses. So, and then I have a similar story. I've had parents that have reached out that said, hey, I'm looking elsewhere for, employment. What's going to happen with my childcare? And same thing, I tell them, I'm sorry, but you'll no longer have the childcare here. And they actually found something else within the hospital because they didn't want to lose their childcare. And I can say, like, counting hands, fingers, how many times I've had to say that where people have stayed for that very reason.
For Phelps, both those hospitals are a little further along, but I do think you can just feel a buzz with younger employees that do have childcare needs, that they are very excited about what's going to be happening in the future.
I have a question. When you talk about you get volunteers to come in, so do they need to have background checks and fingerprinted also for your volunteers? How does that work?
Yeah, we do. We have a volunteer services department that takes care of all that. So I don't even have to take care of it. They interview them, they bring them in, they do all the stuff they have to have done.
Okay, so volunteers do need the background checks and fingerprints too.
Yep.
Okay, thank you.
I think Melinda might have said volunteers at one time. Did you say that, Melinda?
Yep, we have volunteers too. Yep.
Yeah. So Sherry, when they're under 18, they don't have to have fingerprints, but they do have to have some other background checks if they're under 18. So
correct. Yep, I know that. Thank you.
And volunteers might a little bit different. Yeah.
Okay. Thank you so much.
Mike Feakin had a question in the chat. How much financial consideration or analysis of workforce retention was completed or realized Columbus prior to moving forward with the project?
We did quite a bit. Kind of like somebody else said, we didn't open it to make money. We are not making money. Our goal is to really just cover salaries and operational costs, period. We do charge a market rate. The center is full, but because of ratios, I mean, there's Melinda will say this, there's not any money in childcare. However, as far as the analysis, like Melinda said, based on the hospital says it's an investment in our staff. It does allow us to recruit and retain. And as far as the losses, Linda says, if we can get, keep or attract one or two nurses, that basically covers the losses. So we've never really sat down and, crunched the numbers specifically to say, well, we can tabulate these three parents of these three kids and at their wages, this is how much it saved us if it either, caused them to stay or caused somebody to come here, because we do know it has been a key factor in the recruitment and retainment of many, many key physicians. I mean, one physician alone, if we were able to bring those here, it saves us $100,000 of loss in recruiting costs. But like I said, we don't do a hard calculation. We just know without it, our numbers look considerably different.
Got another question in the chat. For Phelps, with the model of leasing of the space, are you able to use any of those expenses you are incurring on the cost report as employee benefit, or how is that positioned?
So the whole center will be operated by a daycare provider. So our subsidiary owns it, so it is not part of our cost report at all. And then the provider will provide all the staff, and they'll charge their own rates and have all the operating expenses on. We do probably think we're going to have to subsidize the rent a little, or find creative ways how we can keep that affordable for the provider that's choosing.
Great. Other questions?
I mean, I'll keep talking I'll start talking if everyone wants me to, but I've heard a number of instances talking about the taxability of the projects. And I'm curious to see, so Columbus, you had talked about the city, which I'm curious to see where that is, because Nebraska statute is very clear that a nonprofit organization that runs a childcare facility, it will still stay tax exempt. So I'm just curious to see where some of that information is. And in the chat, I'm going to post the statute.
And that's a great point, Mike. I'll clarify. So when I say tax exempt, it's for real estate taxes. Real estate taxes, not income on your revenue.
Right. No, that's what the Nebraska statute is. It's clear. If you go to, like I said, I put it in the chat box, but if you go to section A, the last sentence, a nonprofit organization that owns or operates a childcare facility is exempt. So that has always been the case, but many county assessors over the years have tried to say that depending on whether or not folks were on subsidy or whether or not there was a curriculum, that type of thing, they would change. So we had a patchwork of assessors throughout the state determining other things. Well, a couple of years ago, the legislature came out and made it very clear. No, it is going to be written in here that a nonprofit organization that runs a childcare facility will still stay tax exempt.
Okay. I would say at the time, let's see, 2020, I don't know if that had anything to do with somebody, rewriting law. But at the time, our our county,
Right. Yeah.
and city were heavily involved in that discussion. So I mean, and regardless whether they said, 10, 20%, they said that was just their guideline at the time. But as long as we maintained, somewhere in that neighborhood, they said, oh, you're going to be fine. So, and again, we're probably 99% of the kids that are in the center today, with a waiting list filled with hospital employees, that even if that weren't what you're saying weren't true, Mike, we feel,
You'd still be, yeah. Yep.
yeah,
Yep.
yep. But thanks for pointing that out.
Mike, I probably misspoke too, but I know we've went down that road with our assessor in York County before about our childcare, but also I know I'm a nurse by trade and I don't pretend to be an expert on finances at all, and I don't want to be, but there are parts of this that really also relate to the Medicare cost report. And so I'm not positive.
No, I'd say you're not alone. There have been a number of counties that their assessor or their board of equalization had interpreted it a certain way, but now the legislation is clear, the statute's clear that it does say any nonprofit that owns or operates a childcare facility will be tax exempt, still stay tax exempt.
Can I ask one other question real quick? Are we done with that? When you say that in Columbus, you have childcare, but you also have drop-in childcare. So just to clarify my question a little bit, we're trying to get a new center in Ashland, built a big aquatic center that we would have our own little building too for childcare, kind of connected. So how do you do the drop-in? How do you know how many drop-ins are going to be there, I guess, and how do you staff for that?
I don't. I just staff my day, and if they call and need it, then we look and see if we have room. So for instance, today there was a girl from Nutrition Services. She has a 3 and 5-year-old. She needed in, so she could go to work, and we said, this is our availability. This is the times we have. These are the, rooms that these children could go in. And, it's $60 a day plus meals. Do you, up to you if you want to take it. And, then she said, let me take some time. She called me back, and she's here 9:30 to 4:15 because I didn't have any availability after 4:15 because I would have had to have staff work longer, which would be like overtime. But generally, we only take a drop in from 7:45 to 4:30 is generally kind of our hours, but it's got to work for what we have. I don't staff for it, outside of that because we can't.
Very ad hoc.
Our schedules are done 3 weeks in advance. So generally I will tell them, if you know you're going to need something within 3 weeks, let me know.
So, that's all of your staff there. I understand that. So are you go back, you're only licensed for so many, so you have to have, so you're not completely full and you have some spots left for drop-in. Is that right?
No, we are completely full. It just depends on the day. Not all of my families are full-time. A lot of them are nurses that are part-time. We have part-time and full-time contracts. So there's days where every room is at max capacity, and there's days that they're, not. Like we had, a couple gone in pre-K today, and we had one gone in preschool prep today. So I was able to do it. But generally, and it's the summer, so we have people on vacation Bible school last week, and, just little things like that. But.
And then you already have all of their info on file, like all their medical and emergency contact and all that.
They have to have that filled out to even become a drop-in. So like this gal, she never had filled it out, so she had to come in and do it all this morning before the kids could come.
Okay.
So
thank you so much.
Yeah.
I may need to come visit sometime.
Absolutely. We'll take you anytime.
Okay, thank you so much.
Melinda and Tamara, how do you guys handle when you're recruiting new staff and trying to bring in, say, for instance, new physicians, or recruiting for a specific role in your hospital? So it's a very specific specialty or something you want to fulfill, and they have children but you don't have a spot. Do you do those kids go on a waiting list? Do they get priority? Has that happened?
Yes, they do go on the waiting list. We always bring them into tour right away and have them sign up their kiddos. We also obviously advertise that we have childcare. We do our best to get everybody in if we can. We usually get almost everybody in, but there has been times where they've had to wait 6 months, but we try our best.
We're kind of the same way. I mean, if it's an emergency position like that, they have to have, like, we had a hospitalist that they had to get in. There was, we figured it out and we actually opened up another room and added more kids off our wait list. And that's where we got rid of the school age room, because we got rid of the school age room to put the pre-K room, and then we moved the school age room to the activity room, and then we got rid of the activity room and put in that toddler prep room to make room. So it's kind of like sometimes you got to do what you got to do to make it work. If those high, those hard to recruit positions need in, we just usually try to figure out what we can do. Like, we have wiggle room. I actually am licensed for 155, but we don't jam pack our center because we want quality, not quantity. So I have it. I could bring in, a PRN is what we call them. Again, they're fingerprinted, they're got all their paperwork done, everything the same. I can call them in and say, hey, I need somebody to come in from this time to this time, or, I need this covered to make things work too. I have a little wiggle room at times, but I want quality, not quantity.
So can I ask too, again, with that PRN and with, the drop-off kids, is that $60 a day from infant through school age,
No,
or
they're all
toddler?
different. So the $60 a day was our preschool. So then toddlers is 65 and infants would be $70 for the day. Now they're set a little higher because it's a lot to bring in a drop in. It's a lot on your staff. It's a lot on your routine. And sometimes it just kind of helps that bringing them in.
And do you make your parents, sorry, I'm asking way too many questions, but
Totally fine.
do you make your parents like pay on Monday so that then they pay their whole week? And if they miss days, that's just,
No,
they don't.
if they're coming, if they tell me I'm going to come July 10th and I put them on the schedule and they say, oh, I don't need care that day, we just don't have them that day. We don't
What
have
about your
bands.
full-time people though? Like you
Oh,
have,
like not you said PRN, so that's why I was confused. Like our usual people, or
yes.
so like our usual people, we charge every 2 weeks, not in advance.
And if
hours.
And if they're not there, if it's a snow day or you close, they still just pay for that, correct?
Well, we don't close for snow days. We also
Okay.
are open holidays. So we don't really close because we have physicians. The only days we're
Right.
closed are Saturday and Sunday.
Right.
Like never. We've had snowstorms where we've had 6, 7 people because the doctor's got to work or nurses got to
Right.
work. Like, we don't have that. We
Okay.
don't.
And you're open on Saturday and Sunday also.
We're not open on
You're
Saturday.
not.
Yeah, it's the only
Okay.
day we're closed. Yep.
Okay, thank you so much.
Yeah.
Also was kind of wondering if you could share a little bit. I'm sure in order to run a childcare facility, it takes some braiding of funds. So just some of the examples of where you are utilizing maybe state, federal, or local programs to supplement your childcare.
We don't have any.
We don't have any either.
Us either.
Okay, there is question in the chat. How are wages taken into consideration for childcare cost?
I don't know if I have a great answer to that, but like I said earlier, we do not operate to make money. We know we're going to lose money. We pay our teachers a wage much higher than they could make anywhere else in the community and working in a childcare, and they get full benefits. So that's what we
Columbus is
do.
the same. Yep, Columbus is the same.
Retention is worth it. All right. Any other questions?
I just have a quick
I
one.
like that the comment that retention is worth it, because it's not just retention of your employee staff, your nurses, your cleaning staff, your doctors, but it's sounding like with the ability for the hospitals to implement these programs and provide benefits to those early childhood employees, which is a rarity across the state. I'm assuming that's also creating retention within your early childhood staff too.
Definitely. Yeah, Columbus, we've seen it, we've witnessed it. I commented, even Melinda, on her last eval, we've looked at the turnover for childcare, and we may have had one or two individuals out of 30 leave. So turnover for childcare was actually less than the rest of the hospital, which is almost unheard of.
I mean, we have really good retention for our childcare staff. I have 4 staff that work down there that have been here for over 15 years. So we do have some really good stability. And the parents, that's important to our families and the parents. So we really focus on making sure the benefits and the pay are top notch.
For York and Columbus, are your rates like basic market rates, or do you feel like you're offering your employees a discount for childcare costs because they're utilizing your services, or how do you position that those
So
rates
ours
within?
are a little probably less. They're pretty much where everybody's at, but maybe just a little less, just for a little bit of a benefit to them.
So years ago, we were quite a bit less than the going rate in the community, but when we started planning for the new center and going through the whole process of design, about 3 years ago, I started calling all the area childcare centers, and I've even called Melinda to compare what they're charging and just kind of getting an average of all those. And then we kind of try to be right in the middle of that average, or not at the top, not at the bottom. So that's kind of been our current philosophy on the rates.
So I forgot the last question. I lost my train of thought, but I thought about it now. But just with retaining of staff, like they can do what they love by working at a childcare and get paid a good amount for childcare. Sometimes you have a lot of people who do have those degrees or do want to work with children, and that's their passion. They want to do it and they want to stay because they're getting paid well and they can do what they love. And to have a job that you love is really hard to find, I feel like. It's not, I mean, it's a lot for someone to be able to say, I love to come to work to every day. I love my job. And so I feel like we give them that opportunity by letting, giving them the wage they need to be able to work with the children.
Well said. All right, we've got about 2 minutes left if there are any remaining questions. Okay, I counted to 10. All right. Well, thank you everyone for joining us today. This was absolutely fantastic. I dropped that link in the chat to the August registration. Like I said, we're still working on the topic, getting that confirmed, but we'll get that information out shortly. So thank you, everyone. We will send this recording out
Thank you.
through your technical assistant. Thank you so much. Have a great day.